wear your knee-high boots because it's the wettest, bloodiest case you'll probably ever do. So
the wonder of childbirth.
yes. So once you get draped, which is just going to be the typical draping. Now, out in the field, you might see like a special C-section drape, and it has like a round little thing for the tummy, and it has like a big pouch around it to catch some of the goodness. All right. So what incision do we make? Yeah, good job. Fan and still incision. Okay, so they make fan and still incision. And depending on how much of an emergency it is, they just might use a scalpel all the way down through. But if not, then it's just going to kind of be the regular thing of getting into the abdomen. Right, so the knife, the bovie down through the fat. When they get to fascia, they usually like a couple cokers on the fascia. And then they're going to divide the muscle, and they're going to get through the peritoneum, maybe a couple hemostats and some mets to get through the peritoneum. And then the surgeon and the assistant are going to get their hands in the wound, and they're going to pull with all of their might, open up that incision, and then usually, where's the deaver? We don't have 3 deavers? I mean, bladder blade?
No, we just have the 2.
Okay.
And the other trays.
All right, so typically the C-section set will have a bladder blade, and that's what you want up. You might also want some Army Navies or Goulets as they're like, you know, dissecting down. But as soon as they get in, bladder blade just, would that be posteriorly? Inferiorly? I don't know. Anyways, at the bottom.
Inferiorly.
And then,
I gotta open it. See.
so one thing that we don't have, I know we don't have, is the bandage scissor?
No.
We have
We got
one
bandage
blister, I
scissors.
think.
Yeah.
So to get into the uterus, typically what they're going to use is they're going to make a nick in the uterus just with a 10 blade, and then you'll give them the bandage scissor because they'll like put that on the inside of the uterus next to baby, and they'll cut. All right. Yeah. So do you guys remember the Lister bandage scissor? Okay. So they'll use that knife and then Lister bandage scissors to open the uterus, and then they're gonna puncture the amniotic sac, and fluid is gonna go everywhere. So make sure you have your laps ready, you have suction ready in the real world, and then it's gonna be time for baby to come out. So at that point, you want to get all metal off your field because you don't want like baby to get a comp on its head or something. So I'm gonna take everything off.
Sorry.
There is one retractor called an Alexis, and it's like a soft, pliable little like 2-ringed thing with plastic between, and so part of it will go inside the abdomen, and part will stay out, and they like roll it down, and it keeps this nice round incision, and it's soft and it's squishy, and it's okay. It can just stay there the whole time. Well, depending. So once they're gonna get ready to get baby out, get your blankie and get your booger sucker, your booger grabber. Okay, the little baby bulb syringe, blankie and bulb syringe. Did I miss anything yet? Okay.
Then one C-section.
Okay.
One emergency.
One emergency.
So it was kind of,
like a real emergency,
Yeah.
just slash and dash.
yeah, slash and dash.
So get your blanket, get your sucker. They're gonna get baby out. Now, what if babies breach? If babies breach, they're gonna open up the uterus, and there's gonna be this really slippery baby bottom, and you just really can't like get a hold of the baby bottom. So a blue towel works really well if you see that. All right, if you hear them talking like we're doing a C-section because the baby's breached, blue towel is something handy to have. Okay, so once baby comes out, they're gonna want the little baby bulb to suck out the mouth and nose, and then they're going to put the cord. All right, so 2 clamps, usually peons, or if they have the cord clamps, but we're just gonna use the peon clamps. Clamp, cut between with a bandage scissor. 1 clamp, and the bandage scissor is gonna go off with baby. Baby's gonna get passed off. So remember that those things are off your field, right, when you do your count. most places that I've worked, they have like a C-section tray, so there is not all of these instruments. It's just what you need to do the C-section.
Nice.
Other places might be different. I don't know.
I think most do.
We had our own trays.
Yeah. So let's see, where are we? Baby's out. We clamped and cut the cord. Baby's off. Now it's time for us to just clean up, right, and close up. So at that point, they'll probably want some irrigation. They'll wash out the uterus. Oh no, I lied. They'll take out the placenta. And at that point, they might want to do cord blood. So they'll do cord blood. They'll deliver the placenta. Usually, you want a big bucket to put the placenta in. Sometimes they'll want to send it. Sometimes they won't. You need to ask. And then they'll wash up. All right. So they're not going to use an asepto. Notice we don't have an asepto. You're just going to give them the bucket. They're going to pour it in. All right. So when we do it, maybe we can just use this blue basin. A lot of times when I did C-sections, we would have the double ring stands and you would have a double basin. So one you put sterile water in, and then that way your bloody instruments can go in there when you're done with them. But it's not a have. So they'll irrigate, and then what? They're gonna close the uterus, I suppose. So you'll pass your first closing stitch. What do we have? Ovicral or? Okay, so you'll pass your ovicral. Sometimes they'll want some empty sponge sticks. I mentioned that before. There's a couple up there, but they can get on each side of the uterus and just kind of use it to approximate the edges of the uterus as they're closing it. Something like that, so once you pass your first stitch to close the uterus, what do you have to do?
Full count.
Full count. Full count. All right, so then they are done closing the uterus, and they might want to wash some more, and then you'll pass your first closing stitch for the wound, and then count everything again. It's going to be a race to the finish line. And then I don't know what other stitches we have. Are we just going to use O? What?
Yeah, on the card it just asks for the 2 ovicrals and then
And
staples.
then staples.
Staple.
Okay. So there you go. Probably when they're closing adipose or they're getting close to being done closing adipose, go ahead and initiate your count, your final disposable count then, because by the time you are ready for the staples, it's like boom, 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 they're done, and you really don't have time to count. So maybe once they're closing fat, and maybe as instructors we can just say, okay, we're closing adipose, and then that can be your trigger, for that. And then just wash up and dress it, and we just had a birthday party. Yeah, what else did I miss, or what are you guys thinking of? Questions? Yes?
I had a question. Mrs. B highlighted the empty syringe for cord blood. So for, I'm just remembering, the book says to have like 2 specimen cups handy to collect it. So with the syringe, what are we doing with that instead?
My experience has just been you pass it, they draw it up,
Okay.
and you just pass it off.
Okay.
That's been my
Typically, the
experience.
syringe just gets capped, and
Yeah.
they send the whole syringe.
Yeah.
Okay.
Yeah, you don't typically transfer the blood from one to another.
Okay.
Yeah, typically if you're drawing blood for any reason, you typically send it in that syringe.
I've had them put in the med cup and then I've drawn it up and then handed off or
Yeah.
however.
And we still ask our same questions and everything for labeling and handing off.
Yeah. I mean, it's just, gonna be, for the cord blood, I think, it's cord blood, we're like,
There you
okay, it's
go.
cord blood, you pass it off. If it's the placenta, then you can go ahead, if you're like, okay, do you wanna send the placenta? That's a good question to ask. Yes,
And
we wanna
sometimes
send it or no.
patients wanna keep the placenta too.
Eat it.
Yeah.
My daughter kept hers and they planted it with a tree,
That's cool.
so she had a
Eat it.
hummingbird. She delivered it.
Yeah.
Placenta smoothies.
Yeah.
Or dry it out. I don't know what
Negative.
to eat it.
It tastes like liver. I do not like liver, so no.
I'll stick with my toe.
You're like, nah, it's okay.
Yeah.
I'd rather just eat
Yeah.
it.
Throw it away.
When they ask me if I wanna keep mine, I'm like, no.
What else? Other questions?
Broil it.
Comments? Thoughts? Valeria?
Placenta tacos.
If it's an emergency C-section, then scalpel, sponges, some suction. Go. Alright, I've done real, like, one real true emergency C-section. You guys, I've probably told you about it, but they said, oh, they called, we have an emergency C-section. I'm like, alright, yeah, okay. It's usually not like, you know, they're rushing them in, but this time they were. And I had just barely even went and got the supplies, and I'm walking into the room, and like they almost mowed me over. And so yeah, it was just like bust open my pack, jump into my gown and gloves, just have a scalpel to get in, some sponges, some suction. We didn't even put up Bovie. He just, you know, decreased fetal heart tones, just cut all the way down, got the baby out.
Yeah, that's how ours was. We didn't end up even counting instruments.
Yeah,
Yeah,
no.
it's pretty quick.
No, you forego counting instruments, did all of that. Mine was not a happy ending. I know. So labor and delivery is super fun until, you know, something like that.
So it isn't.
But